Unfortunately, we're all going to get ill at some point in our lives. Thankfully, drugs like paracetamol can make us feel better in no time at all. Pharmaceutical companies can mass produce these common drugs and painkillers very easily, as well as mass producing specialist drugs to treat diseases such as HIV and cancer. But what are in these wonder pills, and how would you go about making them? I don't know about you, but I hate taking tablets. So what can we do to make our tablets more pleasant to consume? Well, we want our tablet to be easy to swallow, we want it to be pleasant tasting, and we want it to deliver effective therapeutic treatment. So let's have a look at what we can add to our active ingredient to achieve this. We're now going to have a look at how we can manually create a tablet. For this example, we're going to create a caffeine tablet. The key part of any medication is the actual drug that's used. This is known as the active ingredient. In this case, we're going to be using caffeine powder as our active ingredient. This is the bit that actually makes you feel better. However, you might be surprised to know that the active ingredient only actually makes up a few micrograms of the overall tablet. But in order for the tablet to be large enough to swallow, we need to add something known as a bulking agent. In this example, we're going to use some dicalcium phosphate to increase the volume of our tablet so it's large enough for us to swallow. The dicalcium phosphate will also act as a flowing agent. This means that when we mix our powder together, it will help us to easily pour the powder into our tablet press. We'll also need magnesium stearate and silicon dioxide. These act as a lubricant agent as well as a binding agent. This will make it easier for us to make our tablet and then pop it out the other side, as well as making sure that our tablet stays together and doesn't fall apart as soon as we've made it. We want to mix together all of our powders to ensure we have an even powder distribution. This will be done in industry with something known as a dry powder blender. We then want to add a small amount of water, approximately 15 ml, to the powder to help the binding process. To create our tablet, we simply need to fill our tablet press roughly 1/3 full of our mixture. Then we, at the top bit, apply a small amount of pressure, and then we can pop our tablet out. So this is what is done in industry, but on a much larger, more automated scale. The process still stays the same. On an automated production line, they pour in the powder, provide a small amount of pressure, and simply pop out the tablets. Earlier we mentioned that taste is an important factor in producing an acceptable tablet. So this tablet will be sent off for a glucose coating. This would help to extend the longevity of the tablet, as well as making its taste acceptable. Not much has changed with tablets in the last few years, so what does the future of this type of medication look like? Patients metabolize drugs at different rates, depending on their liver enzymes. So if we tested a patient's liver enzymes, it might help to ensure that we prescribe an optimum amount of drug for treatment. We can use 3D printers such as this one here to print our tablets. This links into the idea of personalised medication. We can, using one of these printers, print one tablets that contain multiple different drugs to the exact right dosage that that patient requires. This could be especially beneficial for older patients or patients with dementia that may also have complicated health requirements. Therefore, we can print what would be 10 tablets worth of medicine into one tablet. If they only need to take one tablet, this will promote compliance with treatment. Although the concept of personalised medication is exciting, the time taken to print one tablet could be up to 5 to 10 minutes, whereas it only takes a couple of seconds to produce a tablet using a tablet press. Therefore, the future of personalised medication may only be fully utilised for those with complex health conditions.